Before, when we had fewer numbers, each patient would be attended to for over 30 minutes. Now that attention will reduce to 5 minutes to 1 minute because there are too many people to attend to. And then we shall start seeing the number of deaths increase.
That is the warning the Minister of Health has as the number of COVID-19 cases rises. However, medical experts from Uganda Medical Association are suggesting that medical facilities be limited to only severe and critical COVID-19 patients and have all asymptomatic cases cared for from their homes. The experts say that all the Ministry of Health would have to do is to strengthen its response network and pick up patients from their homes when conditions deteriorate.
There is no advantage in admitting asymptomatic patients given our current limited bed capacity to manage the very serious cases.
Government needs to guide us. Apart from quarantining everyone who is positive, it also needs to guide us. What else can you do?
I don't understand where the worry is coming from. We have Numberless Stadium, which is large enough to accommodate. If we have other challenges, we'll put tents outside. It is better to put people who are having the virus by themselves in a tent than put people whom you are just suspecting together.
But Minister Ruth Aceng says that would escalate the spread of the virus.
It would have been easier to isolate people at home if we had setups like in other countries where in homes there are fewer people. You find a mother, father, and one child or two children, and each has their own rooms. However, ours is a bit of a challenge because eventually the sick person feeling no symptoms will be tempted to come out.
She also says the behavior of many Ugandans may not be trusted when they are sick at home.
We tried what we call self-isolation. And many of the people whom we requested to go home on self-isolation, we would find them in the center of the city. We are following them up there in the center of the city, having contact with many other people. If we attempt self-isolation, we may end up spreading the virus even more.
The proposal, she said, is nonetheless to be discussed by the Ministry's Strategic Committee on Tuesday. Experts worry the situation may get out of hand unless government acts beyond what Dr. Obuku thinks are political statements in a political season.
Once there is corruption, all these systems cannot function. Because everybody is thinking of getting something. And I think that's the problem. Otherwise, if we can, at the beginning we were really determined and organized. If we had maintained that one, all these things are possible.
Another catalyst for the virus, the experts say, is the time between testing and the return of results.
When a test is done and it takes a day, 2 days, 3 days, what is going on through this person's mind to begin with? What SOPs is this person effecting in the meantime? So an immediate result would be very good.
Our results take between 12 to 48 hours. If it delays, it is 72 hours. In some countries, results are gotten between 7 to 10 days.
There is a need now to invest and train more laboratory personnel if we are going to increase the testing strategy. Early detection and isolation and treatment will reduce the burden of infection in the community. And therefore, if we invest in the human capital, in more labs, in more equipment, and looking for a cheaper, easy-to-use test at point of care or point of treatment.
Today, Uganda confirmed 155 more COVID-19 cases, bringing the cumulative number to 2,679 cases. Edward Mhumza, NTV.